2 words: humanizing healthcare. That's the mission and passion of Jamie Edwards, CEO of Cloudbreak Health, a unique telehealth platform in more than 650 hospitals nationwide, nearly 2 million encounters. The word is out, and it's growing fast, and he's with us today on Red Hot Healthcare. Let's go.
3 alarm at 21 and north. All engines respond.
This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and welcome to the show. I'm your host, Steve Ambrose, and you can subscribe to Red Hot Healthcare on iTunes, Stitcher, and other podcast directories. And we love to hear from you. Just send your comments or questions to steve@redhothealthcare.com or hit me up on my Twitter handle, PolymathSteve. Today's show is being sponsored by Medisend, any size medical office, facility, or hospital. Let Medisend analyze your current medical waste services and fees. You can remain with your current waste vendor, and Medisend will lower their ongoing fees to you. Medisend gets paid only if you save. Or switch your medical waste services to Medisend. They often save new clients up to 30% or more off current vendors, and fees remain level from year to year. Just go to redhothealthcare.com, fill out a few fields. Guys, I can't do any better than this. Medisend is good people with great intentions. Save with Medisend today. And now, we're ready for the show. Cloudbreak Health is a fast-growing unified telemedicine service that was recently awarded the Patrick Soon-Shiong Innovation Award. CEO Jamie Edwards comes from an extensive leadership background in multi-specialty care, as well as on the financial end through Lehman Brothers Investment Division, where he consummated transactions in excess of $8 billion. He's always been about big things, and this looks to be his biggest yet. Jamie, welcome to Red Hot Healthcare. Great to have you aboard.
Thank you, Steve. It's my pleasure to be here. I'm honored.
So let's get into Cloudbreak Health. The product is really unique, and its beginning was unique as well. You brought together 2 separate companies and technologies to make this happen. So what I'd like to do is have you start telling our audience a bit about that story.
Sure. It was really a natural evolution. My background initially was in investment banking and private equity, as you mentioned. I was with Lehman Brothers in their communications and media group, and I got to work on deals like taking Google public and the hostile defense of the entertainment company, Six Flags, the amusement parks. But what I got to see was companies doing it right and doing it wrong, which was a really interesting thing. The great thing about that industry is that you get to lift the hood on a lot of businesses and really see how they run and how their cultures were built. While I was doing that type of work, there was a gentleman who was my uncle who was running an emergency room physician group in Southern California. And I helped him build his infrastructure and helped him move out of his home office into a real office. And he continued to grow his practice. And as he grew his practice, he eventually said, Jamie, I'd like you to come and help me with the business full time. And so I did. I left New York and moved to LA. And the rest is kind of history. I spent the next 10 years really learning healthcare from the ground up, seeing the issues that my physicians faced every day in their emergency departments. You know, we all have a patient perspective, but not all of us really understand the issues that doctors face. And there was a lot of angst as the healthcare industry was changing in front of them, and their practice needs needed to change as well. So what ended up happening is we ended up growing Emergent Medical Associates, which is the ER company, into an ER hospitalist and anesthesia organization to the leading group in the Southwest that saw about 1 million patients per year. And then back in January of 2008, our chief medical officer of that company, a gentleman named Dr. Val Warhaft, sat on the board of a company called the Language Access Network and introduced us to the company. And we liked the company, what the company was doing so much that we stepped in to take the company private and continue to grow it. And that company was called the Language Access Network. And the Language Access Network performed remote video interpretation services in hospitals. So you push a button on the screen, or back then it was on a remote control, and within 30 to 90 seconds you were connected to an interpreter, because one of the fundamental issues that limited English proficient and deaf and hard of hearing patients have in a hospital is how do they communicate where it hurts? How does a physician really understand how to diagnose them when the number one diagnostic tool a physician has is communication with the patient? If you look at a medical chart, two of the biggest areas of the medical chart are what's the history of the present illness and what's the patient's family history. And for the 1 in 5 patients who present to a U.S. hospital today, they had no way of conveying that information. And so what doctors would do is they would practice, a lot of diagnostic testing, right? So it's kind of that concept of defensive medicine costs, so that they could try and diagnose the patient, as opposed to using this wonderful tool that humans have considered fundamental to their encounters, which is communication.
So, Jamie, you spoke about Language Access Network. I know that's an exciting technology. I'd like you to get a little bit more into that with the audience if you can, and its importance to what you're doing at Cloudbreak.
What we realized is that one of the first things that Language Access Network was doing was solving a healthcare disparity, right? Limited English proficient and deaf and hard of hearing patients not receiving the same standard of care as their English-speaking counterparts. All the studies would show that they were twice as likely to encounter harm. Their patient satisfaction scores were lower, and their outcomes not as good. So that was the first disparity that we really helped solve, bringing an interpreter into the patient and provider encounter in a timely fashion. All of our interpreters are certified medical interpreters, so they're all highly skilled. They receive the most training that any interpreter receives in the market, and all we do is healthcare. So that thorough understanding of healthcare really helps us train the interpreters to target the issues that these patients and providers face, and they know how to help them get them resolved. So as we built the company, there were a few things that ended up happening. One, we ended up seeing every hospital networking environment imaginable, and we really built a competency on how video should navigate their networks, how video should traverse their networks. And it was interesting to see the pressures that these IT teams were under, because we were in the throes of meaningful use. And so what typically happens in a hospital, right, is clinical will come and say, hey, Mr. CTO, CIO, make this happen, right? Meanwhile, they have a bunch of competing priorities. So a part of our process was really to partner with IT and make sure they were part of the decision and make sure that they had ownership in this process and that it wasn't being foisted upon them. We ended up building a lot of trust. And so we started helping hospitals with video, networking, their security, how to navigate the firewall. And we realized it was difficult to do as a language services company. So we split the company into two, and we split it into a company called Connection. So the IT team and the private broadband network over which LAN connects went into the Connection side of the business, and Language Access Network was able to remain focused on their strategy of being the best language interpretation services company they could be. So it ended up creating these two different platforms that were linked at the hip.
Yeah, you're really intuitive with the sales channel or with the sales process, because there's 61 million Americans who don't speak English at home. I think tapping into that is extremely important for two reasons. One, as you say, communication is so very important between providers and patients. I mean, that is probably the most important facet of great outcomes, is great communication. And the second thing is recognizing that in order to tap into a lot of people in our communities who may not be seeing doctors now because of that language barrier, you need to be finding people with chronic disease and even pre-chronic disease states that need to be engaged sooner. You have 650 facilities around the country, and I know you've had really fast growth with the company here, Jamie, but what sort of proportion of users in your system are using the interpretation services?
Every single one, right? So what we discovered as we were building the company was that the language services were what we would refer to as a gateway telemedicine drug. People understood that it made sense to bring in an interpreter this way, and then you'd install the system, and you're like, great, you're on the telemed platform. And they're like, oh my God, we're doing telemed. There was like this realization on our client's part. They're like, wow, this video, it really works. I can push a button on the screen and get the resource that I want, right? So it allowed us to really drive a lot of adoption because this use case was very easily understood. And then hospitals started using it to market, the fact that their hospital was a culturally competent and friendly hospital to limited English proficient and deaf and hard of hearing patients. And we've actually had different health systems, like Omaha Children's just recently shot a video on our service. We didn't ask them to do it, but it's a wonderful video that really shows that when people are understood and they don't have the same level of anxiety because they're able to communicate what ails them, right? Yeah. And they're able to trust the provider because they know the provider is listening to them. So it really has, driven one adoption of the platform, but it's driven a new culture at a lot of the hospitals that we've served because now at the push of a button and in a timely fashion, they have easy access to a resource. This concept of, this being a gateway telemedicine solution. And Steve, you mentioned something that really triggered something in me because it's part of our core company's mission. And you mentioned the word empathy. This whole concept of humanizing healthcare and this hashtag humanize healthcare that we have on Twitter is all centered around the fact that we're humans, right? And humans have stories. And one of the important things to understand is that physician burnout is a huge issue these days in hospitals across the country. In fact, physicians are twice as likely to be burnt out than anyone else in any other industry as a result of all the stress that these physicians go through. And I saw this firsthand when I was managing the ER hospitalist and anesthesia group. They start to treat patients like objects, right?
Right.
And so we're in this healthcare system where doctors are treating patients like objects. Patients feel entitled to their care because the insurance company pays for it. And then the insurance company has a totally different set of incentives, right, on their end. So the interesting thing is this whole concept of humanizing healthcare came about because if we could put ourselves in our physician's shoes. So let's say, Steve, you went to see your primary care physician and he was running 30 minutes late, right? You might be really upset about that because your time is valuable. But if you knew that doctor was 30 minutes late because they were explaining to someone that they had cancer and they were trying to spend all of the prerequisite amount of time that they wanted to make sure that person had all the information they needed during this very challenging, message and time in their lives, you might think differently about it. But because of HIPAA and some regulations that are there, they can't share that information with you. So these doctors end up just taking abuse, right, when they're trying to be when they're trying to do the right thing. And so what we've tried to do as a company is make sure that empathy and that concept of humanizing healthcare, so not only treating the patient more human, but doctors being treated more humanely, is part of the message that we deliver, hardcore. And if you take a look at our platform, it's all about making it easy to use, right? So push a button on the screen, get the resource that you need. And if you take a look at how technology has affected physicians today, if you take a look at electronic medical records as an example, I don't think you'd find a physician in the country who would say that has made their job easier. They would tell you it's intermediated their care. They can't look at the patient. They have to document in the chart. In fact, there's been a whole industry of medical scribing that's been created so that the doctor can, again, regain the patient's trust by staring at them as opposed to staring at the computer. So all of our technologies and all of our platforms are built around building that connectivity between patient and provider as opposed to getting in the way of it.
And now, a few words from your host. I get email from listeners that want to know what I do. Hey, I'm a consultant working in two areas. First, multi-level consumer engagement. I provide tactics and strategies to direct engagers, such as hospitals, payers, life science, and medical technology companies. And to indirect engagers, companies that sell products, software, and services to the direct engagers. If you haven't created tactics, strategy, and partnering around engagement, don't be surprised when consumers continue to close you off. Second, I'm a heavily connected networker who strives to connect pieces that drive innovation, collaboration, and mutual benefit. Every relationship I carry across multiple healthcare industries is open for contact, conversation, and business. Everything's changing in today's healthcare, and in many ways it's become an unsettling and yet opportunistic Wild West. Reach out to me if your company would like new thought, tactics, and strategy to increase growth and profitability. And now, we're ready for the show. One of the words that I keep hearing you throw out, and you're threading it into your conversation, is trust. The area that I focus on in my consulting business is patient engagement. And one of the things that I tell providers and hospitals and health systems is that, look, you've got all this wonderful whiz-bang technology, probably drive costs lower and help with outcomes. But at the end of the day, you've got a human being on the other side of this that has to engage. Don't assume that they just simply want to engage or they're going to be as excited as you are. They don't want to be treated like a commodity. They want to be understood. It's more about trust and sort of stepping into a relationship where the patient begins to trust and value the process that you're valuing as a doctor, as a provider, as a health system. You have something called Unified Telehealth. And I'd like to just, if I could, ask you to explain what Unified Telehealth is and maybe how it differentiates from other telehealth platforms out there today.
Sure. Our unified telehealth platform is all about bringing all of your specialties together on a single interoperable platform. So we had an epiphany a few years back when there was a telestroke patient that needed a Spanish interpreter. And so how did the hospital solve that problem? Well, they had best-in-class systems for both. They had, a great company doing telestroke, and they had us doing language services. And so they rolled both devices into the room, right? And so it was machine talking to patient. And that to us didn't seem very collaborative. It was a poor patient experience, poor provider experience. The encounter took much longer than it had to. So what we decided at that point of time is, we want to bring everyone together on the same platform, break down the walls between all of the providers, have them all be able to be on the same call in a very patient-centric fashion, and provider-centric, by the way, right? Because the provider in the room now has this whole care team on the phone with them and on the video call. So that was a key part, was bringing all of these specialties together on the same platform. And we were the first people then to integrate other, the first multi-specialty call, right? The first to integrate an interpreter into telemedicine. So that if there was a Spanish-speaking patient or a Japanese-speaking patient who needed telepsychiatry services, well, we've done that. And it makes that encounter seamless. And what happens, you had mentioned trust. People need to trust the platform too. And what you want with technology is that technology to fade away. And all people really feel is that person's presence on the other end of the line. You want them to feel like the doctor or the interpreter is in the room with them. You don't want them thinking, wow, this technology is really cool. If that's what you've done, then it's not a great technology because people are noticing it. You want the technology to be unnoticeable.
Patients now can have a resource at their bedside in 30 to 90 seconds. Put that in perspective. What do you mean by that?
So we view the hospital room of the future as being a connected care room. So there's a patient bed in there. There is a TV on the wall with a camera. You hit a button on the screen, and all of a sudden, all of these resources can be brought to the bedside. Now, most hospital infrastructure isn't built from that. So you see when you walk hospitals today, a lot of carts. And these carts wheel from room to room, and they are the stopgap measure prior to these connected rooms being built. And there are hospitals across the country where they are building out these new connected telemedicine rooms, and they've proven to be really effective and really efficient. The key to the 30 to 90 seconds is that time is money in a hospital, and time is outcomes in a hospital as well. For something like stroke, there is this concept of the golden hour. And the decision in stroke is, do I push TPA or not push TPA, which is the clot-busting drug? And that decision needs to be made in a certain time frame. And people are tracking things like door to thrombolytics, which is what TPA is, or door to balloon times for different types of situations. So the key is to get the care that people need as quickly as they can get it, because not only is it important for the patient's outcome, but a lot of hospitals are struggling today, and they need to be seeing more patients more quickly without a degradation in quality. And a lot of times, a lot of these waits in hospitals are caused by a resource not being available. And so if I can bring it to the bedside in a timely fashion, that bed gets turned over more quickly, the patient gets out of the hospital more quickly and back to their lives, and the provider can then go and see another patient who needs their help. That's really the goal. And so being able to hit a button on the screen and get an interpreter within 30 seconds, being able to hit a button on the screen, have that telestroke consult happen within 30 seconds or 90 seconds, not only is it important financially, but it saves lives.
Yeah, let's talk a bit about the financial end. Now, you have a background in finance, certainly, and Cloudbreak has been really growing quite quickly. We talked about the reach that you've had already across the country. You received an investment back in July of 2015, and I'd like to have some idea as to how that was used towards your growth, and then maybe how you're still growing at this point in terms of your current growth and maybe your future target goals.
Sure. So we did a $15 million deal with Kane Partners, a growth private equity fund here in Los Angeles. They're part of Kane Anderson, which is a $28 billion asset manager. A really great bunch of folks. We actually went through our process and we had term sheets from 6 or 7 different people. And we arrived on Kane because they really understood what we were trying to do. They had an investment in the space already. They had a previous investment in MD Live. So they really understood what we were trying to accomplish. And they understood that even though we were pivoting our language services business, that the platform that we built had applicability beyond just language services. So they were able to see the vision. So we used the proceeds from that deal, one, to clean up our capital structure, but two, to invest in our platform and really build what is a scalable, reliable platform that's now used, 60, 65,000 times a month, right? So we know it works and that you can rely on it. And then 3, in our customer service teams. So one of the things that a lot of technology companies haven't locked into is that when you're asking someone to use a new technology, you're asking them to change the way that they've practiced in healthcare, right? Where lives are on the line. There's this risk aversion to new technologies in healthcare that I'm not sure exists in other industries due to the fact that, 1, the industry is entrenched in the status quo, but 2, that you're asking someone to change what they learned in medical school, or a nurse what they learned in nursing school, and say, this is a better way to do it. We view telemedicine as the new stethoscope. It's something that should just be an integrated part of every care provider's, daily routine is, what can I do over telemed? Because it makes my life easier and the physician's life easier, and it still maintains the same quality.
I know that telehealth is getting a lot of competition now. There's a lot of players, and we talk about some of the big names like American Well and InTouch. So maybe you could talk a little bit about how you see Cloudbreak differentiating itself against the other players. Is it purely value-based? Is it technology? Is it the interpretation? Is it all of it?
Well, there's a lot of great companies out there that are doing amazing work from the standpoint of telemed. You mentioned American Well, you mentioned InTouch. Both those platforms have grown rapidly. InTouch was a little bit of a pioneer in their own right because they were the first people out there really with robotics. There are different viewpoints on the usefulness of the robot, but the fact of the matter is they've done a great job with their platform, and so has American Well. I think one of the things that separates us from people like that is 1, we view ourselves as a healthcare solutions company. So we're not a technology looking for a solution, but rather we've assembled a bunch of different technologies into one platform, which makes us largely technology agnostic, right? So with us, a Skype for Business hospital can speak to a Polycom hospital, can speak to a Cisco hospital, can speak to a VidYO hospital. It allows our hospitals to leverage their existing hospital IT investment and their existing infrastructure, and we can turbocharge it by plugging it into our network and our ecosystem of providers. What we're really trying to be, I would say, is the Salesforce of telemedicine. A hospital can come to us and say, we'd like to consume services on the one side in your language services, but we have a center of excellence we would like to share with the community in stroke. And we can bring that all together on a single platform and not only have their telemedicine infrastructure help them reduce their costs on the one side and improve their own care, but allow them to build their market on the other side. People talk about population health today, and that term usually means, how am I going to treat a chronic disease state in a given population, in a given geography, right? How do I make people more well? Our definition of population health is a little different. It's about bringing healthcare to the people where they are on any device, anywhere, anytime. And so our platform is literally available on billions of devices. It's iOS, PC, and Android. It's laptop, PC, laptop, desktop, mobile, tablet. We've tried to make it, again, easy to access the care and build the access. And that's one of the things from a mission standpoint that allows us to reduce these healthcare disparities that are in market. On the language services side, there are other companies out there like Stratus Video and In Demand and Language Line and Siricom. Again, all good companies who do a good job of what they do. I think one of the ways that we differentiate ourselves is all of our interpreters are US based. So we're not offshoring patient health information. Stratus has a language center in Costa Rica, and they do that because they are trying to, compete on price and put a quality product out there at a lower cost. And, a lot of companies are taking a look at offshore to do that. That's just not our methodology. And it's, again, why we're more expensive. But we feel like there's more value there.
I spoke with a top 100 CIO the other day, and he knew I was interviewing you. What he was surprised about was how quickly and how wide Cloudbreak has grown, across the country and putting itself in the systems. What do you think's been the major catalyst there?
Yeah, that's so funny, Steve, because we're kind of the biggest telemedicine company no one's ever heard of, right? And it's because we're enterprise, right? We don't have a B2C direct marketing campaign to patients that gets the name out there. It's quite the opposite. We talk to CIOs and CTOs, and when they finally learn about our capabilities, there's like this light bulb that goes off. Wait, you guys are in my hospital performing language services, but I can use that same platform investment and do telepsych, and I can do telestroke, and I can do telerheumatology and telementoring and all these different types of things? The answer is yes. And then that is a great discussion for us to have. So our company, we always enjoy helping partners solve their problems. And as a result, as a result of this track record of success of not only innovation, but people seeing that our technology works, because there was a lot of instances where there are promises made in telemedicine that don't get delivered. Well, we deliver. And as a result, we get a lot of referrals from hospital to hospital to hospital. And I really enjoy that problem-solving process with these leadership teams of these facilities who are like, we're trying to accomplish, launching a new telestroke program, but we don't know where to start. Can you help us? Those discussions and being able to create something from the ground up for them, or take an investment that they felt like wasn't a great investment and make it an amazing investment for them, because they say, well, we invested in this telemedicine platform and it's not being used the way that we thought it would. Well, great. Let us help you solve those problems. And as a result, we've helped build an ROI on something where there wasn't an ROI before. We've seen this done over 600 times in hospitals across the country. We know the issues our clients face. And so if there are any interested systems and clinics out there that want to have these discussions, they can go to our website at cloudbreakhealth.us. And if someone wants to email me directly, jedwards@cloudbreak.us is my email. They can email me and we'll get them set up with an initial kind of brainstorming or consult call, whatever it might be. There's an amazing dialogue happening on healthcare innovation, and people should be involved in it.
Jamie Edwards, CEO of Cloudbreak Health. Jamie, I want to thank you for making the time today. Certainly, we'll be hearing more from you in the future. It sounds like the path is north and continuing to go that way. So good luck. And again, thanks for making the time for our audience today on Red Hot Healthcare.
Thank you for having me, Steve. This has been a great discussion, very thought-provoking for me as well. And I'm grateful. So thank you very much.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.